Good morning, good afternoon, or good night to whatever time you're watching this video. Um, this is me and my partner Mandy's presentation on infectious mononucleosis.
Mononucleosis, also known as mono, otherwise known as the kissing disease, is an infectious and contagious illness, meaning that anybody can catch this disease through direct contact of bodily fluids. The Epstein-Barr virus, also known as EBU, is one of the most common causes of the infectious mononucleosis, while other viruses can also cause this disease. This disease is common among teenagers and young adults, and especially through college students. At least 1 in 4 teenagers or young adults will develop mononucleosis when infected with Epstein-Barr virus. Although mono is contagious, it is more likely to catch other common illnesses like a cold than mono. Mono isn't usually a serious illness, but you can have complications that may make the disease more dangerous.
And I'm writing about EBV infection. So first, try to remember that EBV can infect the following cell types: epithelial cells, B cells, and T cells. And I'm writing T cells in gray because they're a little less important. But if you know these cell types, then everything about EBV is going to be a little easier to remember. For example, the pathogenesis. A new EBV infection occurs when saliva gets from one person's mouth to another. No surprise then that it's called the kissing disease. So EBV enters the new person's mouth and infects epithelial cells in the pharynx. It replicates in those and spreads around the oropharynx until it finds its main target, B cells. And also, less importantly, a few T cells. And where are those going to be? Well, they'll be in the lymphoid tissue of the oropharynx, which we call tonsils. Now, the B cells then traffic throughout the lymphoid tissues of the body, which is normal whether they're infected or not, and this allows the infection to spread to these other lymphoid tissues. And after some time, the infection is controlled with a combination of antibodies that bind the free-floating virus and cytotoxic T cells that kill infected B cells.
Mono is most commonly passed from person to person through the exchange of their saliva, which is why it is also nicknamed the kissing disease. It takes about 4 to 8 weeks before the symptoms of mono even start to appear. In addition, not only can you get it from kissing, but it can also be contracted by being exposed through a cough or a sneeze or by sharing utensils with a person that is infected with mono. That is infected with mono.
Mononucleosis is a common disease, which means that everybody is capable of getting this disease. Teens and young adults ages from 15 to 24 are most likely to get this disease and will most likely experience the classic and severe symptoms. Teens and young adults are the most active with deep kissing, which is where loss of saliva is swapped from mouth to mouth. They are also more likely to share food and drinks with one another. By the age of 40 years old, 85 to 90% of American adults have formed antibodies to the Epstein-Barr virus, which means that at some point in their lives they have been infected with the virus.
The history of mono. In the early 1800s, German scientists coined the term glandular fever or Drüsenfieber because of the symptoms expressed by the patients. And in 1920, the term infectious mononucleosis was coined by Spren and Evans in the bulletin of the Johns Hopkins Hospital. It was only in the late 1960s that mono and the Epstein-Barr virus was actually found to be related and that it was the Epstein-Barr virus that causes mono. Epidemics and where they are in the world. Outbreaks of mono is most common in places where a great number of young people are present, for example, schools and colleges. Everyone is susceptible to mono. There is no region or area that hasn't had somebody infected with mono. Furthermore, most people will be infected at least once in their lifetime with the virus, and they may not even show symptoms of the Epstein-Barr virus, but they are still carriers of it.
For a diagnosis, A doctor may do a physical exam where they check your lymph nodes, tonsils, liver, or spleen, and any other place in your body where you listed your symptoms. They may also take blood tests, for an example, an antibody test. This allows the doctor to check if you have created any antibodies to the EBU in your body. Another test that a doctor may take is called the white blood cell count, which is where the doctor looks for an excessive amount of white blood cells or any abnormal-looking lymphocytes. The classic symptoms of mononucleosis includes fatigue, sore throat, or strep throat that has not gotten any better when taking medicine for it, a fever, swollen lymph nodes in your neck and armpits, swollen tonsils, headache, skin rash, soft or swollen spleen. These symptoms range from being mild to severe and may affect normal daily activities for several weeks.
Treatment of the disease. Okay, so there isn't like any specific treatment that can be used to treat mono. The only thing you can do is to rest, take lots and lots of fluids, like mainly water, and like maybe take some over-the-counter pain medicine and fever reducers because one of the symptoms of mono is a fever.
Many people experience a recovery with no long-term effects. However, some may experience having fatigueness for several months after recovering from the sickness. The survival rate for mononucleosis is extremely high, while mortality and morbidity rate is very low. These are the sites we used to complete our research of mononucleosis.